Hello, good evening. So we have our guest today with us, a medical student. So he's like to share his experience about his medical school and how is it going. So without delay, let me introduce myself first. This is Suharsha. So I'm a second year medical student from Philippines. So I'll be introducing today's medical student or guest. So here go. So, Ashwin,
Yes. So, hello, my name is Ashwin Chawla. I am from Thailand. I am currently 20 years old and I'm a medical student in KMITL or King Mongkut Institute of Technology, Ladkrabang in Thailand as well. I'm currently in second year.
okay, thanks for the background. And could you more tell about your family background and basically where are you from?
So in Thailand, I am from Phuket. My parents, I am half Indian, half Thai. My mother is Indian. My dad is a Thai citizen, but all my grandparents and my ancestors are all from India.
That's nice. So, can you tell us about where do you study and about how many years you need to study program or the program which is provided by your college?
Yes. So I study in King Mongkut Institute Technology of Ladkrabang, which is an international program. Currently a 6 year MD program where everything is taught in English. And after 6 years, you are given a certificate to become a doctor, even though you still have to take your national license first.
Okay, so that's nice. Can you tell about your study program, like how many people in your class, and is there any international students and is it like more theoretical or it's like more practical?
Yes, so we are actually the first international program in Thailand that teaches medicine. So currently in my class, we have 32 students. They have made sure to have a less amount since their teaching style is more discussion based than lecture based. We have a mixture of both practicals and theory, but since it's a small class, you can easily ask the professor for questions and clarification, and it is more of a student to teacher approach, like it has to go both ways rather than just the lecturer coming and giving you a lecture and then leaving. So it really emphasizes on your teaching. They make sure that you understand everything that they've taught you, which is quite nice. And also we are training for like the USMLE program side by side. So everything in the syllabus is related to USMLE and the national license exam in Thailand.
So, in your college, they more focus on theory or practical or both parallel?
We are both kind of parallel. We make sure to put as much practicals as we can. So basically, after every lecture, we probably have to go to do a lab, whether it be something really simple in like biochemistry to anatomy to gross dissection. So they make sure that it's an like easy learning for everyone, both practicals and theory.
Wow, nice. Good to know about that. So, what do you think for the best teaching method according to you?
So I believe that everyone has different learning methods, whether some prefer it in fully lecture, some prefer it fully practical. So I feel like the best way to cover most students would be to have a mixture of both. And also in my opinion, I really prefer case discussions. This is something that my university does a lot. After we've learned about a subject, we are given a case that we have to have to go into small rooms and discuss within our groups and then come and present to the professor, thinking that what do we think is the diagnosis and what can be the treatment. I feel this really integrates what we've learned into our minds, and it makes it easier to remember, and is also more practical in real life when we actually become doctors.
That's nice. It's a basic step to keep a foundation to learn simple things. So, uh, so in this pandemic, how about your study? Like how this pandemic changed your study habits, or how are you preparing in this pandemic?
Yeah. So when this pandemic started, our faculty decided to go online. And since it's something new for everyone, there was, yes, a bit of difficulties in teaching because now we lack all practical since we cannot come to the faculty. However, we like our professor did make sure that we we should make the best out of the situation. So if there were any labs, the professor would either take the video of them doing the labs and explaining it more thoroughly to us. And during exams, like there would be we would have to learn more than usual. There would be extra classes. So because we all know, like I feel that learning online does kind of like lower your understanding quite a bit because there might be technical issues there, and also you are in a more comfortable place like at your home, so there are more distractions. So the professor tried their best to make sure that we are still focused, and for the exams it was also all online, although the professors made sure that we there wasn't any cheating going on by opening our cameras and making the exam more essay based than multiple choice, since it is obviously harder to cheat and easier to get caught if you're in an essay based exam rather than an MCQ.
I feel you. I feel the pain or difficulty of the online classes, which usually stresses the medicine student, right? So,
Yes, yes.
what all the activities have you been joining, or aside from the studying? So, did you join any organization or competition or something like that in your university?
Yes, yes. So in our university, there is a event called Freshie Games or Cassette Games, which is when all the faculties come. It's like a sports day for all the faculties. We come, we have sports, there's basketball, football, volleyball. I have joined in all of the sports. And apart from that, as an organization, I am currently the president of my class for the second year now. And I'm also part of the student council. I am in charge of public relations between students. So if there's any problem, students can come to me. And my job is also to promote the faculty, take care of its Facebook messaging and everything.
That's wonderful because you're in the quality of leadership. So, what do you think about this pandemic? Like, what exactly medical students should do in this pandemic?
Well, I feel that yes, this pandemic has been quite challenging for everyone here, especially students whose like education has, like I wouldn't say completely stopped, but hindered, made it, yes, less effective. So I feel that most things that we have, the first thing we have to kind of care about is our mental health, since being in lockdown, we are quite isolated from going outside. And yes, it can take a mental toll on you. So we do kind of have to make sure that our mental health is okay. That and if we are not, then we should seek help, whether it be online from your professors or from your parents or from texting your friends. So and for about studying, I feel yes, even though that there's a pandemic, everything's online, it's locked down, but we still have to maintain our efficiency and our learning habits. Yes, it can be more difficult that you'll start becoming slightly lazier. So that's where if you keep on like disciplining yourself and making sure that you still have an adequate amount of like study time, it should be fine.
Thanks for mentioning about the mental health, so which is usually less cared in our profession. So, as Ashwin said, we must take care of our mental health. So, so what made you to become a doctor, and what made you to choose this medical profession?
Yes. So in my family, my uncle is the only one who's a doctor in India currently. He's a child specialist. So I don't get to meet him much, but throughout throughout my years, I've always thought of medical profession being a noble profession that requires leadership, like your willingness to learn, and most of all, passion. And throughout like my studying years, I've done shadowing in a hospital where I really enjoyed learning and caring for others. And I feel that this would be one of the best professions anyone can take, including myself, since I feel that I have all the qualities necessary for it and I would make the best out of it.
So, is there any special interest in any specific specialization?
So currently, since I'm still a second year student, I agree that I don't have much knowledge on this fields yet, but coming in, I have interest in orthopedics, but I am open to other specialties as we go on, and hopefully, I'd be more uh, like less. I'll be less confused about which where I want to go, and more determined, and I'll be able to tell that which field I like more.
Okay, so good luck with that. So, can you sum up some quotes or any advice to other medical students who are listening to our podcast?
Yes. So actually, recently, there's this new application called Clubhouse come out, and I was on it recently, and then I heard some place where it really kind of struck me that to be a medical student, the most important thing you need isn't being smart or anything, but it should be passion. Because without passion, your life as a medical student is really, really hard. There aren't many people who can actually just pass med school without having a passion for it, because we all know medicine is not a high paying job, it's not a high reward job, but so everyone that comes here should know that they are doing this to do good for others and not for benefits for themselves. Because this is what I tell my juniors as well, that if you're in medicine to earn money, then you should probably choose another job, because medicine is not something that can get you money that easily. Even after you graduate as a doctor, it's not something it's not that you will start getting millions immediately. It takes a lot of dedication, hard work, and you always have to be open to knowledge since it's always changing.
Really, your words were so inspiring. By listening to you, I just remembered a quote saying like "Vaidyo Narayano Harihi," which means doctor is next to the God. So, as you said, like passion is really important. Uh, the person who is in the medical field. So, is there anything you want to share again to other medical students? Any of your experiences?
So throughout me, I would actually definitely say that because from transitioning from high school to become a medical student, it is a really big change. It is something really different from what you've learned in high school, and it's just, I would say, to keep an open mind, because it is always that you are shifting into a new place. You'll meet new people, there'll be new teaching styles, new professors, and you eventually do have to adapt to it and make the best out of it no matter what. And most of all would be to not give up.
Such an inspiring words of yours, Ashwin. So thank you for sharing your experiences and giving advice to your other medical students.
Thank you so much.